distribution of, because the water takes up body heat much easier than does the air, and it ensures freedom of movement. So actually there are more, you have more degrees of freedom in your movement in the water than is actually possible on dry land, because on dry land we always have a floor beneath us, and in the water that is not necessarily the case. Yeah. So let's talk about the different degrees of freedom that we have to influence a therapy in a pool. Now, what you see in this picture is just a normal pool, a normal swimming pool containing water, right?
Excuse me, Mr. Can you just the screen is stopped, I guess.
Stop sharing.
Oh.
Yeah, the sharing screen. Can you share it one more time?
Yeah, sure.
Thanks.
Okay. Is this better now?
Now it's perfect.
Okay, good. Okay. So what you see in this picture is just a normal swimming pool. Now, in a normal swimming pool, what are the things that we can actually influence? A normal swimming pool, I am assuming that it has a fixed depth. So the only thing you can actually influence is the temperature of the water. So as a therapist, you can ask the technician to heighten or lower the temperature of the water. And as a therapist, you can tell the patient to go harder on the exercises or to go slower, right? That's basically what you can do with a normal pool. So these are the degrees of freedom that a therapist has in a normal pool. Now, if we add another axis to this system, for instance, by entering a movable floor into the pool, we can also influence the depth at which the patient is exercising. And by changing the depth, we can influence the amount of weight bearing that is on the patient. So we can influence, for instance, the pain that the patient feels in their hip or in their knee, if their hip or knee is damaged. So with introducing a movable floor, we basically have 3 degrees of freedom, and you can see that on the left bottom: the temperature, the depth, and the intensity of the exercise. And now we can look at the physical abilities of the patient, if they are high or low. You know, a highly able patient will probably be able to train at a lower depth and with a higher intensity of the exercises. A patient that is not so able, you will probably set the depth of the pool a little bit deeper, so the patient doesn't have to bear the weight so much, and maybe you reduce the intensity of the exercises a little bit. Now, this is what is meant with the pictures that are on the left lower corner of this slide. Nou, hoe gaan we dat doen? Okay. Now let's introduce a fourth degree of freedom. What we can do is integrate into the movable pool floor an underwater treadmill. And an underwater treadmill enables the patient to do walking exercises whilst staying at the same place. And there's a big advantage of this for the therapist, because it's very easy for the therapist to watch the gait pattern underwater. This can be followed by cameras, for instance. But if there's no cameras available, the therapist can just look from the side what the patient is doing in the water, even though the patient is walking. So that's a big advantage. Now, Here we have another degree of freedom. So not only the intensity of the exercises, but also the walking speed can be influenced, as well as the depth. And in this picture on the left lower corner, you see the typical profiles of patients with a lower ability that are early in their rehabilitation stage, and patients with a higher ability. But we can go even further. Of course, we can also introduce something that makes it harder for the patient to coordinate their gait. And this is why we can add to the whole mix a countercurrent. And this countercurrent makes it just harder to keep balance. It makes it harder to place the feet correctly and to maintain a proper gait. Now, all these, you see that the more variables we introduce into the picture, the more degrees of freedom the therapist has to cater the exact right circumstances for the patient to have a good rehabilitation process. So the more the degrees of freedom that are introduced in the pool, for instance, a movable floor, an underwater treadmill, a countercurrent, the more possibilities there are to make the circumstances ideal for the patient to have proper rehabilitation. Okay. So let's now tell you something about the importance of the right depth. As I said, the depth that the pool has been set to determines the amount of weight unloading on the joints and the spine. So the deeper the patient is immersed, you can go up to 90% of body weight reduction, right? So if only the head is sticking out of the water, the skeleton is only carrying 10% of the total body weight. Now, this is, of course, important. You can imagine that if a patient is just out of surgery or out of an incident or has just incurred a big injury, you will want to train this patient with the least amount of body weight as possible. And then slowly, as the patient progresses, you will be able to increase the weight bearing on the patient until the patient is so able that you can continue in a normal gym, right? Which is what most physiotherapists do with the patients that are more able. I think maybe 70, 80% of the patients in physiotherapy are probably treated with gym equipment to get them better. Now, there's one other thing that has to do with the buoyancy that is very important, because it is many times looked over when the effects of aquatic therapy or hydrotherapy are explained. So we are all familiar with the most important aspects of that. We have some, by the way, we have some nice YouTube videos about the physiology and the physics of aquatic therapy or hydrotherapy. If you want to watch them, you can always go to our YouTube channel. We have our own YouTube channel as EWAC Medical, so you can just look up EWAC Medical in YouTube. But okay, let's go to the hydrostatic pressure and what is going on there. Most of you will understand that in the water you become buoyant, right? But what is very important to understand is that there is actually a pressure gradient. Now, the pressure gradient means that in the higher levels of the water, the pressure is not so great, but the deeper you go, the more pressure is exerted on the human body. That is a very interesting effect. So some of you might be familiar with diving, for instance, and the experienced divers know that the deeper you go into the water, the higher the pressure will be. And of course, the diving equipment has to adapt to that. Now, the human body can also be very nicely influenced by this pressure gradient, and I will come back to that in a later slide. So please remember the pressure gradient, okay? So the pressure increases as you go deeper into the water. All right. Now the pathologies where aquatic therapy can be applied is honestly a very, very long list. We are always mentioning the most important pathologies where aquatic therapy or hydrotherapy comes into view as a means of treating patients. But the list is actually, I think, maybe even 10 times longer than the list that we are mentioning here. But I will go through the most important ones here. So the first one, mental health. Yeah, you wouldn't say so. But it is actually true. There has been some research here in the Netherlands where they went into the pool with patients suffering from dementia, and they have seen clear signs of the brain fog disappearing for a few days after this intervention. So even in elderly patients with dementia, just going into the pool and asking them to carry out a few tasks offers a nice increase in their mental abilities. Now, dermatology and burns, there's a nice video about that also on our YouTube channel. In this case, limbs that are restricted because of the very tight skin as a result of a burn. If you go into the water with these limbs, the people are able to increase their range of motion. And it works on, it doesn't only work on the physical body, but it also works on the psychological effect, because these people are severely scarred. And joining others that are also severely scarred in the pool also gives them some ease of mind that they're not the only ones that are suffering from these disfigurations. So a very interesting field as well, hydrotherapy in burns treatment. Now, the next one, oncology and lymphedema. Many times, cancer patients that have been treated with chemicals, that have been treated with radiation, and after that, they have had some surgery, which is like a quite normal progression of cancer treatment. They develop lymphedema, and lymphedema is a swelling in the limb, so either the arm or in the leg. Now remember that I just told you about the pressure gradient in water. This pressure gradient can be very nicely applied to patients suffering from lymphedema, especially in the leg. Because what happens in the lymphatic system is that blood is carried from the heart down into the leg, downwards into the leg. The fluid that is in the blood, the plasma, let's say, diffuses through the walls of the arteries that supply the blood, and it goes into the intracellular space. And this fluid should then be discarded off, or should be taken up by the lymphoid system, the lymphatic system. But many of these cancer patients, they suffer from, this lymphatic system becoming stuck, basically. And all the water, all the plasma of the blood being stuck in the intracellular space. Now, this is where a very interesting effect comes in, and that is the pressure gradient that we have in water. The lymphatic system basically works as a pump that is powered by the muscle movement. So just moving in water with the limb, just making some simple exercises in the water, can help these patients to get rid of the lymphatic fluid that is trapped in the leg. So this is why the pressure gradient is so interesting, and this is why hydrotherapy or aquatic therapy can be so helpful with lymphedema patients.
Mr. Eric, sorry for interruption, but you have the host right now, so could you please just accept the people in the waiting list?
Oh, yeah, of course.
Yeah, thank you very much.
Yeah, I'll leave this to Tuin. He's letting these people in right now. Yeah. So welcome everybody. Rheumatism, fibromyalgia, osteoarthritis. These are probably some diseases that you have heard of before. Neurology, we will show this in a nice video, but neurology is in itself a super wide field where many things can go wrong. Musculoskeletal problems. So here I'm talking about people suffering from knee pain, hip pain, basically pain in their whole musculoskeletal system. Post-surgery trauma, sports injury, geriatrics. I already referred to that a little bit with when I was talking about mental health. Pediatrics. Yeah, it's always nice to see a child with some kind of a problem in the pool, because immediately they start to smile and being in the water is just fun for them as well. And then cardiopulmonal. This is a whole different topic within hydrotherapy, but what I would like to at least introduce you with is that the blood will be spread in a different manner than on the dry land when you go into the water, because basically this hydrostatic pressure, or this pressure gradient that we've talked about, pushes the blood from the limbs to the central volume of the body. So there's more blood available in the central parts of the body, and this is why in water the heart can actually function more efficiently. So the pressure on the heart, the power used by the heart goes down, and the stroke volume goes up in the water. Okay, and then of course we have many methods that intersect with all these pathologies. So I will name a few. The Bad-Ragaz method, for instance, is a method where the patient goes into the water. The therapist goes into the water with the patient, and by using some floating rings and some movement, which is coordinated by the therapist, they can together carry out some exercises. Oh yeah, and I think one of the most important ones before you go into the water with the patient, when the patient is not so familiar with the aquatic circumstances or the aquatic medium, that's the Heliwick concept. Heliwick is a way to easily make a patient acquainted with the aquatic environment. So some patients are not able to swim by themselves, which is for us, you know, we are Dutch, of course, everybody can swim, so we are very used to that. But in other countries, that is not the case. So in a pool where a patient can just stand, it is important to carry out a few steps so they familiarize themselves with being in the water and how they move and how they keep their balance in water. And that will take away their anxiety for drowning. And of course, this anxiety for drowning has to be taken away before you can actually start and doing the exercises with the patients. Somebody's asking for access, so we will let them in. Okay. The next slide, please. All right, and then we can also differentiate between therapy techniques that are active and passive, or even are both active and passive. We made a whole list here in this slide. And I think it would be good for everybody to just read these different methods later on. There's also a nice article about this on our website. And by the way, just talking about our website, we also have a lot of scientific articles that are available on our website that you can just look through. And we regularly write blog posts about aquatic therapy and about all the ins and outs of that topic. So if you just follow us on either LinkedIn or other means, then you can keep can stay updated with with the latest news on these topics. Next. Okay, so now what do we view as a differentiation between active and passive therapy? So active aquatic therapy involves the patients actively performing exercises and movements. In many cases in active aquatic therapy, we try to get the patient to do two things at the same time. For instance, keeping their balance and holding something in their hand and carrying it to the other side of the pool. And this is a way to actively engage the mental capacity of the patient, as well as the motor system. So with active aquatic therapy, the mental involvement is one of the important factors. And I've written the word sympathetic behind that because this involves the sympathetic nervous system. The patient has to actively interact with the environment. And passive aquatic therapy is where the patient remains relatively still and the therapeutic effects are from external sources, for instance, the therapist himself. And the aim of passive aquatic therapy is relaxation, actually. So to release muscle tension, to increase range of motion of stiff places in the body. And we try to get the patient into the parasympathetic zone. So very relaxed and enjoying the therapy. Okay, so therefore the goals of active and passive aquatic therapy are different. In active, we are trying to improve strength, flexibility, and balance. And in the passive therapy, we try to promote relaxation, decrease pain, and improve circulation. So these are two different approaches to aquatic therapy. And for on the equipment side, so if we look at what kind of equipment is necessary for these kinds of therapies, then in active, you might see some kickboards, noodles, weights, resistance pedals, and other tools. And in passive, you might use some flotation devices, water jets, or other things to provide relaxation. And that's always under the supervision of a therapist that actually gives the therapy to the patient. Okay. Okay. There's another person wanting to be admitted. Okay. Good. So the therapist's role is different in active and in passive aquatic therapy. So in active aquatic therapy, the therapist is a little bit standoffish with the patient and just gives instruction from the side of the pool to the patient what to do next. And with passive, it's actually the therapist that is in control of the movements of the body. Okay, and I think, yeah, so for now, this is enough for this slide. You can always read this later on because you will get the slides as well. Okay. Now let's give some examples of passive and active kinds of therapy. Watsu. is a combination of massage and joint mobilization, and it is clearly, as you can see in the picture, under the guidance of a therapist who goes into the water with the patient to move the body of the patient around in a very relaxing manner. You could almost fall asleep in this, and that might be very beneficial for some of the patients. Aqua Pilates, this is some kind of a crossover. This is very modern, actually, very modern crossover between active and passive therapy. Actually, this is a new product that we have just introduced into the market. You can see the patient here laying supine on a small bench in a bath, and above the patient is a television screen where she can just follow the exercises that have to be carried out. So we have a nice video about that as well. I think it is here. This is the one. And so I think you get the idea, and the idea is actually that exercising in a warm water environment will make the joints and the muscles more flexible. And this is a very nice example of a crossover product between active and passive aquatic therapy. Kun je deze even toelaten? Yeah. Okay. Now this is an example of the Batra gas ring method. The guy in the picture is actually Johan Lambeck. He is going to give a presentation, I think next month or something.
December.
December. Oh, the 22nd of December is what I just heard. In Cleopatra Hospital, somewhere in Egypt. So if any of you guys would like to do that training, that might be interesting. And he's teaching a WST, which stands for Water Specific Therapy. He actually tells you what to do with these methods and goes into the pool and gives you the examples. He's a very experienced guy. Now this you see some key points in the Batra gas ring method. It also enhances muscle strength and endurance, reduces pain, and improves the mobility of the joints. And there are some nice pathologies mentioned also in the patient groups. So neurological conditions, chronic inflammatory diseases, and chronic spine problems. So it basically just helps the fibers in the muscles to relax and then improve the mobility of the musculoskeletal system. Okay, this is a different picture altogether, what you see now. This is a very interesting client of ours in the Netherlands, where they have decided to build a pool right next to the ICU department of the hospital. And the reasoning is that if patients are just coming out of coma, they need to start moving immediately. And some of these patients have been held in coma for such a long time that they are not even able to move their muscles against gravity anymore. So in the pool, they can actually regain control over their muscles And this is why this hospital has asked us to build this pool right next to the ICU, because upon just waking up, not being able to move, that's a big shock for the most patients. So if one day after they can go into the pool and see that they can actually move, that is a huge psychological relief for these patients. This particular video is about long COVID patients that can start moving again in our swimming pool that is equipped with a movable floor. So let's show it.
This is not just any swimming pool. This pool is located at Radboud in Nijmegen. In this pool, ICU patients who have been ventilating are helped to build up more muscle strength. With physiotherapists, for example, here their muscle strength is increased, they become fitter, and eventually they have to breathe on their own. How that works, physiotherapist Willeke explains to me. You can exercise well with that gravity. People who are very weak and in their bed can't even move their arms against gravity, for example. They are able to move on their own strength in the pool. It's very special for these people to experience for the first time that they can move or stand again. And in addition, if you lay in an IC bed for a long time, looking at the same ceiling, a change of environment is also very important. That does a lot to them. You bend them first, then you do this. That is the movement you also need to stand up. Here's an example. All patients treated in the school have a tube in their windpipe or even a hole right through their windpipe, so they can be ventilated during treatment. Patients here in the hospital who can exercise with, who are no longer contagious, but were really sick with corona. We see that those people are really weak, and this is exactly the group that we can treat well with water. I have already seen quite a lot of sick people here, but when I worked with a corona patient for the first time, I thought, ooh, this is pretty intense. The best moments are when the family is present, and you can get a genuine smile on someone's face by letting them do something they've relearned to do by themselves.
Okay. The next method, clinical IG. This is definitely an active method. The idea is that there's a instructor on the side of the pool, outside the pool actually. This is something that can be very well done with groups of patients. You could say it's some kind of a Japanese style or Chinese style slow movements, slow therapeutical movements in the water. And it works very well. And there's this is by the way Anne Bommer. She's an expert in IG, and she can train therapists to apply IG to patients. Heliwek we've already done. All right. Or no, leave it. I talked about Heliwek already. Okay. Next is balance and gait. Balance and gait training, well, using the properties of the water. Here you see somebody walking on an underwater treadmill, and in the middle of the picture, on the lower side, you see a camera, and with this camera, the therapist can actually see what the patient is doing underwater. And there's a whole range of possibilities with an underwater treadmill. So they can be used for stroke patients that need to regain the control over their gait. With stroke patients especially, it is important to start immediately after the incident, because then the neuroplasticity of the brain and the nerves is the biggest. Elderly to do fall prevention, orthopedic recovery, but also, of course, sports injury. Athletes that have injured their leg somehow, they can more quickly gain control over their limbs in the water, or they can at least start earlier with their training in an earlier stage than they normally would in a gym, because then the mechanical loads on the body are just in the water. They are vastly reduced compared to the dry land environment. Okay, next. Here we see an example of balancing gait exercises, not on an underwater treadmill, but with using the EWAC Medical obstacle course underwater. So let me remind you here that this lady, she's an elderly lady, she was able to do exercises and make movements in the pool that she would never be able to make on dry land. And if there's any progress possible for these kinds of patients, it starts in the pool. Yeah, this is one of the inspiring things that I think that we have here with aquatic therapy. We can help people to do things that they're not used to be doing anymore, because they spend their lives usually on dry land, of course. And it might open some possibility to escape from their ailment and from their cage that they are in. All right, this is also a very nice video of a handicapped child. To the right of the video, you see the guy again, which is Johan Lambeck, who is coming to Egypt to give the training. This is a child who has a neurological problem, and because of this problem, he doesn't have good control of his legs. And I can tell you that after this exercise that he did in the pool, he didn't want to go out of the pool anymore, and he told his father, "Daddy, Daddy, I can walk." Iets doorskippen, alsjeblieft. Verder niet, verder. Ja. Ja. All right. And this is an example of walking on an underwater treadmill, but then more for sports rehabilitation. This video was actually made at a sports facility that we have here in the Netherlands, where they have a very tiny pool, which is only equipped with a movable floor and an underwater treadmill and a countercurrent system, just like the system that I referred you to when I was introducing all these different degrees of freedom at the beginning of the presentation. Oh, great. Okay, I would also like to show you the application of aquatic therapy in elderly people who are suffering from dementia. And as I told you that the minds of these elderly people, they just clear up after a session in the pool. And how exactly and why, we don't know, but we know that there is a definite effect for these patients, which they may be mute most of the time in their center where they are living. But once they have been in the pool, they start making jokes and they even start talking. The effect lasts for about 1 to 2 days. And especially family members are always very happy to have some kind of a response back from their elderly parents. So here we go.
Many elderly in good health, but not all of us have the luck of doing so. Many elderly suffering from dementia find themselves deteriorating in physical, cognitive, emotional, and social skills. Aquamentia is a new conceptual exercise plan containing physical activity in water, specially designed to target this focus group. Per session, the client spends about 45 minutes engaging in several
ايوه تحمل
by the instructor. The client
انا
is
مستحمل بس تصنيف فيه كده
during the exercises is highly encouraged for the client to maintain a sense of autonomy.
بيحرنا
Physical, physiological,
بتحرك طبيعته بس
and
اي يا عم
باشمهندسين في المايكاتنا لو سمحت.
many clients are confined to a wheelchair and are unable to walk properly on land. When entering the water, they experience a sense of weightlessness and are more able to start recognizing several exercises which they've done before.
ما فيش ما فيش اي يا عم يلا على يلا
Knowledge and aims for the optimization of quality of life and the aging process in the best possible health condition. We mainly focus on lots of different walking exercises, but it varies per client. One is able to handle more than the other. We also focus on exercises to train balance and obtain trust and self-confidence. Practicing with the ball maintains a certain level of fun when working and throwing, catching and aiming. When clients are able to swim on their own, we also take them on a swim at the end of the session. An important aspect of Aquamentia is that professionals collaborate with carers, volunteers, and students to be able to provide high-quality personal care. There is always one instructor per client and one assistant. This way, the instructor can guide the client while the assistant can provide physical support for the client, as well as supporting the instructor by handling the needed equipment. So, is the client ever left alone? No, the client is always supported by at least one person, but mostly two. When my client arrived here for the first time, she felt very insecure. She had trouble standing up straight in the pool and walking through the water. After 4 to 5 weeks, she reached the level of independence where she was able to do most on her own and showed a lot more confidence. It is really great to see somebody make such progress. Aquamentia is an initiative of the Psychomotor Skills Educational Program at KALO, Hogeschool Windesheim. Teachers and students cooperate with Stichting Zorgspectrum in Zand.
Okay, now there is a myriad of methods, of course, but I would like to at least tell you about some of the equipment that can also be used in aquatic therapy, like the underwater bicycle. We talked about the treatment of lymphedema before. Underwater bicycle is a perfect way to exercise the legs for patients with lymphedema. And this employs, well, it takes the maximum of the benefit of the pressure gradient that is available in the water for these patients. Then the butterfly bath, well, it's a typical passive aquatic therapy piece of equipment. A butterfly bath has this shape because it enables the patient to spread the arms and the legs, and it enables the therapist to reach the patient from every corner. For instance, to apply underwater massage. And then the burns treatment bath, this is more a medical application rather than a therapy application. And this is more to work on patients' wounds and to care for these wounds and make sure that they clean up well and they get better well. So yeah, so we are not yet ready for questions because I think we have been instructed to do the question session all the way to the end of the presentation. So the next thing I would like to talk to you guys about is the importance of water hygiene. So we are now going to exit the therapeutic side of aquatic therapy, and we are now entering more into the technical field of all the things that you need to take into account when applying aquatic therapy. The reason why we always emphasize this part is not only because we are the equipment manufacturers, but mostly because these aspects are very important, and these are also things that you need to be aware of as a therapist if you go with patients into the water. So let's go. Okay, so a swimming pool, you might notice, you might not notice, can become infectious because of the presence of bacterial food and a relatively high water temperature. And many bacteria and also viruses, they thrive in an aqueous environment. So if you would just make a swimming pool, pour potable water into the swimming pool and heat it up to above 20 degrees, within a week, you will see so much growth that you would not be able even to combat it. This is how quickly these bacteria and viruses can grow, and also fungi can grow in a water environment. So we need to do something about that. Next slide. Oh, and the most common infectious swimming pool bacteria and viruses are listed here. Many of those you will probably be familiar with. Of course, one of the last ones is the rhinovirus, which is like the common cold, but also the influenza virus. All very known viruses and infectious diseases. We should avoid, especially in aquatic therapy situations, to have these kinds of pathogens in the water. Yeah, next. Now, We all know public pools and we know healthcare pools. And next slide. In public pools, of course, you will have mostly healthy individuals, which have an average susceptibility to infections and disease. But in healthcare pools, the visitors can be assumed to be very susceptible to infections, maybe due to recent surgery or a poor physical conditions. Je moet nog een beetje toelaten. Ja. And therefore, and also, furthermore, some of these patients might be the carrier of multi-resistant bacteria. Now, in a pool, we don't want any cross-infection between patients, of course. So in public pools, water hygiene is important, of course, but especially in hospital pools used in the medical sector, water hygiene is extremely important. And not only from a practical point of view, but also because of the liability of the hospital where the patients are treated. Yeah. So this presentation will explain to you the basics of water treatment. And a water treatment plant should consist at least of a few elements. One is a pump, of course, to circulate the water in and out of the pool. Second is a sand filter to filter any particles out of the water. Of course, you will need a water heater to maintain the right temperature of the water. And you need a dosing system for chemicals. And these chemicals are meant to kill any active bacteria or viruses that are present in the pool. Next slide. Yeah. Now, the only safe agent to kill aqueous bacteria and viruses, according to current technology, is chlorine. An alternative that has been used in the Middle East, especially for outside pools, is bromide. But bromide is not as safe and not as, well, it has some, let's say, disadvantages compared to chlorine, which I can explain to you if you want to ask questions about that. And there are other solutions like ozone and UV, but these are not suitable on their own. Chlorine must always be added to the water, and this presentation will explain that to you. Next one. So if you think of the pool as a giant petri dish in which bacteria are present and they are thriving, we would suck out a little bit of that water, for instance, through a straw. We would make that water extremely clean by just filtering out all the solids, heat it, and kill all the bacteria, and then pump the water back into the petri dish. The bacteria in the water will not be affected. They will just have some more clean water. So we have to take into account that in the pool itself, there are always bacteria present, and these bacteria need to be actively killed. And this is why we need to add an antibiotic agent to the water to at least suppress the bacterial growth in the petri dish. And then chlorine has the right properties to do that. Yeah, next slide. So what we should do is take out some water, filter, heat, kill the bacteria, and add some chlorine to it, and then pumping it back into the pool. And this small amount of chlorine suppresses the growth of bacteria that are in the pool. Okay, then sometimes when you enter a swimming pool, one or two of you might have experienced that, it smells like chlorine. But honestly, I'm the expert, I know this, chlorine that is in the water doesn't smell. What you smell actually is the chloramines, and these are gaseous. So these enter the air above the pool and you can smell them. So this is actually chlorine that has been used, that already has made a connection with some kind of a contaminant. So in a healthy swimming pool, there's hardly any smell at all. So if this weekend you plan to go to a pool with your little children, you enter the pool and you smell the chlorine odor, turn around, because there's just too much chloramines in the air, and that means that probably there's not enough chlorine in the water anymore. So just a word of advice, turn around if you smell the chlorine. Okay, so free chlorine versus bound chlorine. Free chlorine is a molecule that's ready to take a contaminant out of the water. Bound chlorine is a chloramine, and that's what I just said. That is what you can smell. So in a healthy pool, you have to maintain a healthy level of free chlorine, and any chloramines need to be taken out of the pool. Next. So, but if there's so many contaminants in the water that all the free chlorine is consumed, that means that the bacteria have won the battle and the pool has become unsafe. It has basically become biologically active. There are some solutions to do that, but the best solution, of course, is to replace the water entirely and then start the whole process over. As I've said, you will get a copy of this presentation, so you have more reading time when you have received it. Next. Now, these are the important facts that you as a therapist should know. So maintain a free chlorine level higher than 0.5 and lower than 1.5. Keep the bound chlorine lower, so the chloramines lower than 1 milligram per liter. And if the bound chlorine is higher than 2 milligrams per liter, then possibly the water has become biologically active. The pH needs to be maintained between 6.8 and 7.8. Around 7.2 is the pH of the fluid that is in the eye. So that's the most comfortable for the patient to not hurt their eyes when they get water in their eyes. Okay. Next one. So bacteria and viruses are causing serious illnesses and can thrive in pools. This is risky, especially when working with susceptible patients. And to keep them at bay, you have to add chlorine as an antibiotic. And whatever method you use to disinfect, chlorine must always be added. And a smelly pool means contaminated water. If chlorine has been added to the pool, but free chlorine cannot be measured, there's a real risk that the water has become unhealthy. Okay, so we basically have, this is the last slide that we can,
Questions?
So there is another presentation already after this, but I think it would be a good thing to now start the question and answer session because we have like 14 minutes left in our presentation time. I don't know how you would like us to do this. Would you like to do this with voice, or should we just go over the questions that are being posted?
There are already questions. There are already questions in the chat sections and the messages.
Sorry, can you repeat that for me, please?
Do you hear me now?
Yeah, I hear you.
Okay, I just said there we have the questions already existing in the messages section.
Okay.
Yeah.
Okay, so the first question is from Iman Sheta. I would like to ask a question. If we have a regular normal swimming pool, how can we convert it into a therapeutic pool, both modular or movable? Is it possible? Okay. So basically it depends on what the size is. So what is the depth of the pool? To be able to make a modular pool, make a movable floor into the pool has to be deep enough, because the movable floor itself also takes up some space, some vertical space. So it depends what is the depth of the pool. And if it's a big pool, we can always build a modular pool into that pool area. But it really depends on size and shape and all that. And this is why it's very important to involve us in the designing process. We always have a high involvement in the designing process. We can look at what kind of patient groups are you trying to treat, what kind of goals are you trying to achieve, and from that, our experienced sales guys can just come to a therapeutical solution that is usable for you. Okay, then again from Eman. What design features would we implement in a hydrotherapy pool to minimize the risk of infection, particularly regarding COVID-19? So, well, just to address the COVID-19 virus itself, just keeping a safe level of free chlorine in the pool will also already prevent COVID-19 from being able to become infectious in the pool. And the most important design features that you have to incorporate into the pool is that you will have to have a sufficient amount of turnover, so pumping the water around from the pool into the water treatment system and then back into the pool. That is important. So you have to have a turnover of at least 3 or 4. So that means that within 3 or 4 hours, the entire pool has been passed through the water treatment system. So that's quite a lot of water actually. And you really need to maintain the chlorine levels that I have just referred to in the presentation. So a free chlorine level between 0.5 and 1.5 is absolutely necessary to maintain a clean and healthy pool. Okay, Karim is asking about using UV sterilization. Is it going to be effective and practical? So the thing with UV sterilization is that it does not reach the bacteria that are in the pool. So it's nice to have because it adds some other advantages, UV sterilization, but it's not affecting anything that is happening in the pool. And the process of procreation of bacteria in the pool will still continue even if you pump a few liters of the water in front of a UV lamp. Okay, so what is it good for? Well, basically, it also actively kills bacteria, the UV sterilization. So it reduces the amount of chlorine that you need to treat the water with. But it is not as in itself a solution for maintaining a healthy pool. So I would absolutely advise against that. Okay. Eman is asking, how can we determine the flow rate of water treatment in a hydrotherapy pool and what are the recommended dimensions for such pools? So the dimensions really depend on what you want to do with the patients, what kind of therapy you want to apply to the patients. So that is really, well, it's really on case-by-case patients. What we do is we calculate with about 4 to 5 square meters that need to be available for every patient in the pool. So from that, you can calculate what size the pool should have. Now, depth-wise, it really depends on, are these patients able to swim? Are they safe in the water? And again, what kind of therapies you would like to, what for kind of exercises you would like to do with those patients. Now, about determining the flow rate of the water treatment in the hydrotherapy, I just answered that question already. So that is between 3 and 4, and for pools, so 3 and 4 hours for the total recirculation of the entire pool volume. But if we are talking about a shallower pool, then that needs to be increased up to once every 2 hours. So those are numbers of thumb, rules of thumb that you need to keep in mind when you are designing a hydrotherapy pool. how long time to change the water from, this is from Yusuf Ahmed, Mohammed Ali Ahmed. How long time to change the water in the pool? Well, this is why I mentioned you have to actively monitor the amount of bound chlorine that is in the water. When this amount is becoming higher, and when it becomes higher than 1, basically you have to add some extra water to the pool, and the runoff of the pool will of course run to the drain. So if you keep the bound chlorine amount, the chloramines that I talked about, if you keep them in check, then you just can keep using the water. And as a rule of thumb here also, we always advise for every patient that goes into the water, you replace about 100 liters of water. So about the body volume of a patient, you automatically replace. Okay. The next one from Eman. What is the total weight of 2 hydrotherapy pools on the 3rd floor after filling them with water, including the weight of the equipment? As a construction engineer requests this. So that very much depends on the depth of these hydrotherapy pools and of course the size. But if we calculate it back to the weight per square meter, if for instance this pool is 1 meter deep, right? 1 meter deep, then 1 square meter will carry 1 cubic meter of water, and 1 cubic meter of water is 1,000 kilograms. If you add to that the weight of the pool, we calculate with about 10% of that weight, then you end up at 1,100 kilograms per square meter for these pools. So, and from that basic calculation, you can expand to any dimension or any size that you would like to take. What is the considerations of pool design? This is also from Yusuf Ahmed Mohammed Ali Ahmed. Well, there are many considerations. On our website, we have prepared a presentation that especially goes into all the things you need to consider when you are doing pool design. And the time that I have available to answer this question right now is not enough to go into all these points. So sorry that I have to give you this answer, but this is just a too complicated and too much encompassing question. So Sarah is asking, can we mention again the definition of the pressure gradient? Of course. So the pressure gradient means that the pressure of the water increases the deeper you go into the water. So basically the column of water that you are in, the depth of that column of water determines the pressure that the patient is experiencing. Now, if the patient puts their leg into the water, you can imagine that the pressure at the foot level of that patient is higher than the pressure at the knee level of that patient. And that level of pressure is higher than the pressure at the hip level of that patient. So this induces an upward flow of the lymphatic fluid through the leg. So this is why this pressure gradient is so interesting and so important when treating patients which are suffering from lymphedema. Okay, I hope I explained that correctly. And if you have more questions about that, you can of course put them in this into this timeline. Eman Shetta is asking, I saw in the company catalog about the shower unit and jet unit. Can you please briefly explain the mechanism of each in hydrotherapy? So the shower unit is something different than the jet unit. The jet unit is used in a pool. So that's basically to create some confusion in the proprioceptive system, but also it's a very nice unit to swim against. So that's to perform active aquatic therapy with. A shower unit is more, well, maybe from the old days of hydrotherapy, when we were using showers to throw cold and hot water on patients. And this is mostly used to improve the superficial perfusion of blood in the skins of the patient. So you can make hot and cold baths, but actually with a shower instead of using baths. Okay, so I see that we are at the end of our questions, if there are any more. Okay, a last one. What is the temperature required in a hydrotherapy pool room? That's a good question, actually. So the air temperature in the hydrotherapy pool room always needs to be a few degrees higher than the pool water itself. The thing is that if the temperature of the air around the hydrotherapy pool would be lower than the temperature of the water itself, you will get an enormously damp atmosphere, and then you will get a lot of condensation on the walls and the ceiling. So we would advise at least a temperature of 3 to 4 degrees higher in the air than the water temperature itself. Okay, Yusuf Ahmed again. Additional technique of ventilator negative pressure using balloon capsule the patient head out of capsule pressure. I think he is referring to the pressure gradient that I was talking about, that can be utilized effectively for patients with lymphedema. And of course, this is also a method that is known, and that is an old technique. That's correct. Okay, so I'll wait for some while to see if there's any other questions coming.
I think that's it.
Oh, there's one. Oh, yeah. Okay. Thank you very much,
Many
Emma.
regards, many thanks. Yeah.
Thank you very much. Thank you very much, everybody, for taking the time to listen to our presentation. There's one thing I would like to point you toward as well. That is that on LinkedIn, we have a special group for people who are interested in aquatic therapy. And this group is called the Hydrotherapy Network. I think it would be good if we actually add this to the timeline. Can we add it to the timeline for everybody? Moet je even engineering. Ali moest even naar Hol gaan.
Ja, ik moet hem eerst alleen vinden.
Okay. Ja, dat maakt niet uit. Yeah. We will put this into the timeline of this chat, okay? So the Hydrotherapy Network, and you are very much invited to join that network if you would like to talk with us about aquatic therapy and everything that's involved with that. Je moet hem even in de chat zetten. Oh.
I will send a link of this group. Also, feel welcome to follow us.
Right. Niet. Je stuurt hem alleen naar. Je moet hem naar alles sturen. Ja. Alle deelnemers. Yeah. All right. So thank you very much for your attention, and maybe see you on Airbath in January. Would love to. So
Yeah,
have a good day, everybody.
Thanks, Mr. Eric, and on behalf of BioHelix and everyone here, I'd like to express our sincere gratitude for taking the time to share your invaluable insights actually today. And your expertise has truly enhanced, our understanding. So we deeply appreciate the effort and dedication you've shown. So once again, thank you.
Yeah, you're very welcome.
And we are looking forward to another collaboration in the future.
We are too. Thank you very much. Okay.
Thank you very much,
Thanks for the invite.
Okay. Have a very good day, everybody. Bye-bye.
Thank you. Goodbye. شباب اللي حضروا ما تنسوش تملوا الفورم عشان إن شاء الله الشهادات. And we would like to thank you all the attendees.